There are people who have left clinics, left their therapist session, and walked right out and killed themselves. Right. So Anthony, there are so many things here around the topic of suicide and why we're afraid to have the conversation. But that fear should also be compelling us to really create more ways of addressing this, because it is now coming down to our younger children. Suicide is one of the least funded of all the health crises that we're dealing with. It is the least funded, it is the least talked about, and it's one of the least that's recognized until September, when it's Suicide Prevention Month. And people are killing themselves every day. Every day.
Welcome to the Bronx Health Reach Community Coalition inaugural podcast. I'm Anthony Davis, who will be hosting the podcast. I'm a community health worker with Bronx Health Reach, an 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. This is our inaugural podcast, and we will first be talking with folks involved in Bronx Health Reach's Men Let's Talk initiative, a men's-only forum for Black and Latino men in the Bronx, where they can discuss with each other issues about their mental, sexual, and physical health. For this first podcast, we are speaking with Brett Scudder, Executive Director of Scudder Intervention Services Foundation Incorporated and the Suicide Institute. Brett, thank you so much for joining us. Can you please introduce yourself and tell us why you got involved in suicide prevention and suicide survival?
Good day, everyone. Thank you, my brother Anthony. Thank you for the opportunity to be here with you. I'm really happy to have this conversation and be part of the inaugural launch of the podcast. My name is Brett Scudder. I'm a suicide attempt survivor. I'm someone who has lived with mental health challenges over the years, been in and out of the health and mental health system as I sought the help needed to address my challenges. I've seen firsthand how these systems work, what these systems do, and how when people go into these systems, sometimes they come out worse than they go in. And so this is why I am here to be part of the conversation addressing this particular topic around suicide during Suicide Prevention Month. So thank you for having me.
Thank you so much. Could you please tell us a little about Scudder Intervention Services Foundation Incorporated and the Suicide Institute, and why you created them? What motivated you?
So that started out of my personal experiences, as I said, over the years, going in and out of health and mental health systems. What I realized is the topic around suicide is not readily understood by a lot of people. And so when I went in for services and tried to get the help, I came out feeling worse than I went in. And I was like, wait a minute, this can't be right. This can't be how these systems that are supposed to be helping people are actually doing as people are coming into them. And so back in 2002, I started formulating what I didn't realize then was going to be this community-based nonprofit organization to help and support people who are living with emotional challenges, psychological pain, and just traumas. And so over that time, launching the Scudder Intervention Services, I also realized that we needed to be more specialized. So we started a Suicide Institute, and our focus is really around suicidality. A lot of people only think about suicide when someone dies, but from my work, I teach about how someone's life can be disrupted by so many different things in our society that leads them now down that path of just losing themselves and ultimately, God forbid, them ending their suicide by death.
Yes, I can speak a little bit on that as well, with just family and friends that have dealt with difficult things in their life, and those difficult things bringing them to dark places that often make it hard to talk about, especially, well, when with men Let's Talk, a lot of men feel like they can't share that information. A lot of men feel like they can't speak about that, but it's very empowering to hear you talk about why you started Scudder Intervention Services Foundation and the Suicide Institute. It's very helpful. Thank you for that.
Thank you.
So, what is suicide, and how should we, the public, be seeing it, talking about it, and even thinking about it? Because we're always told how to feel, but I want to get from your point of view why the stigma and the fear of talking about it can be very hurtful and harmful.
Yeah, listen, I mean, this is one of those topics where you still hear today that people say, oh, it's too emotional, it's too sensitive, it's too heavy. All these different things that are being said to people about this, while so many people are living every day facing the pain and the suffering and the struggles that they're going through. So suicide of itself is an experience. It's not just death. Over years, we've known only about suicide when a celebrity or high profile person kills themselves, and you hear them talk about suicide. So we have thought as a society in our head, we had this thought that suicide is death, right? It's only about death. But my work and from my experiences goes from what is the disruption in that person's life to now get them to from point A to point Z. And sometimes all the letters in the middle of that is this process that we don't hear about until we get to the end, right? This person now kills themselves. And it's so unfortunate because if we keep thinking about suicide as only death, then we're missing a lot of the opportunities or early intervention to help people who started feeling something wrong or something disrupted their happiness or their peace of mind or their comfort. And now they start slipping into this mindset like, I'm not taking care of myself anymore. I can't take care of myself anymore. There's so much pain. There's so much suffering. All these negative things that comes into one's heart and mind when they're suffering. And so if we don't change the thought process of understanding that suicide can come out of a lot of different experiences, we're not going to be able to really help people. And that's why on a national level, the numbers of suicide cases are going up, not because there aren't services. It's just that there is still this fear and stigma about suicide that we don't want to talk about it. And if we do talk about it, we feel like it will trigger people who are thinking of that. And that's far from the truth. There needs to be a very succinct conversation around the myriad of things that can drive someone crazy and how that crazy can get to someone over the edge, push someone over the edge, take a loved one. You know, people are living with pain, even in intimate marriages and families that don't even know that they're in pain. How are we going to do better as a society if we are afraid to talk about suicide, if we're uncomfortable to talk about suicide? Imagine what happens after someone dies by suicide, the pain that's left behind from even the very closest people.
True. I can even understand that from people that I've lost in my life to that. Suicide is something that needs to be talked about more, but not just talked about and then left alone, but something that needs to be constantly talked about and thought about and not just preventing what happens at the end, but preventing the whole process of thinking about suicide and how you get there in the first place.
Yeah, it's happening so much around us, Anthony, that it's scary that we're not talking about it, especially now that we're seeing young children as young as 4 years old who are talking about wanting to die, wanting to kill themselves because of so much that they're going through. So, you know, this is a public health crisis, and a public health crisis at this magnitude of something like this, it needs to have everyone on deck, everyone on deck. We all have a part to play in addressing and mitigating this.
Yeah, I agree. Now, with your foundations in the Suicide Institute, could you tell us a little bit about the suicide rate or the information that your company collects or your foundation collects about suicide rates and just what leads people to even think about attempting suicide?
So the rates, the numbers of people who we see are only we aggregate the data through what comes through our crisis lifeline and our work that we do out in the communities. We can't speak for the numbers of, let's say, for the Department of Health, the city Department of Health, or departments of health across the state or the country. We know the work that we do and the numbers that we see. The CDC's report just came out about the number of suicide deaths in 2022, and that's a very high number, higher than the year before. And so, as we look at the growing rates of suicide for us in the organization, because we are one of the only organization that really specializes in acute suicidality, that means that if someone is actually suicidal, we step into that dark space with them. We take that journey with them. We feel that pain with them. And what that does for us is when you help someone in a time of crisis like that, you're not telling that person, I'm here to stop you from killing yourself, or I'm here to no, you're stepping into that dark space simply because you want the person to know that you are not alone at this dark moment in your life. If you give me a chance, if you give me an opportunity to look at what's going on and to feel the pain that you're going through, together we can work this out so there can be a different way to think about what you're going through. And that's the intimacy of the work we do. Stepping into that dark space, stepping into a time and place where people feel alone, they feel isolated, they feel as if I'm the only one going through this at this time and no one understands how I feel. But what has got me to this place, Anthony, is because I'm very public and open about my living experiences, right? My living based expertise, which I talk about every day. If you've never lived in a pain that is so traumatizing and debilitating, how are you going to think about somebody else who is experiencing that pain? If you're in pain and that's physical pain, yeah, you may be able to take some kind of medication that suppresses that pain, right? But when it's psychological, when it's in your head and it's in your heart and it just really consumes you as a person, where the only thing you can think of is, I need this pain to end. I will do whatever I need to do to get this pain to end. And so when you look at today, the high rates of overdose deaths from fentanyl and xylazine, it's not that people don't know that they're high risk of dying from these type of things. Is they're in so much pain that they're willing to do whatever they can do to suppress the pain, even by a little bit. Unfortunately, that ends up in a lot of overdose deaths, but it's not the substance that we should be worried about. We have a pain crisis. People are in pain, they're suffering in pain, and they're doing whatever they need to do to minimize or ease that pain. And unfortunately, a lot of that comes down to opioids and to other high dose medications. And it's just unfortunate. But we need to have the conversation, Anthony. We need to be talking about pain. What kind of pain are you feeling? Are you managing the pain, or is the pain managing you? So we do a lot of work around the world because we have people who call us, because since the pandemic, especially, we started doing a lot of our work virtually. And so we had people from around the world coming into our listening sessions, men's support groups in general, depression and suicide support groups. So our numbers are not reflected in the national numbers or the state numbers because we don't report to them. We don't have a way to report our numbers to them. But in 2021, we had 2,591 people, 2,591 people who decided that they did not want to be here anymore. They didn't want to live. They were not interested in talking to anyone. They just gave up on life. And as a result of someone either introducing them to us or telling them, hey, you really need to talk to Brett. You really need to talk to Mr. Scudder. We were able to help those 2,591 people see a different path, look at life a little bit different, help them to mitigate the pain, to manage the pain, to reduce the pain, to address the pain that they're going through. And that's every year, thousands of people, because I speak at a lot of events. I speak at a lot of things where I address the topic, and usually people come up to me all the time, sometimes 10, 20, 30 people. I need your help. I heard you talk about this. It's personal, or I have a family member. But imagine if someone wasn't out there, Anthony, on the front line, normalizing this conversation, normalizing the talking about a topic that we are still so afraid to talk about. What would happen to those 2,591 people?
That's true. They're very, very grateful, probably lucky to to have your foundation. I mean, I'm sure there's a lot of people out there that would benefit from something like that, and are so many people suffering from depression and the depression leading to suicidal thoughts and suicide itself. So it can be very hard and difficult, especially because from my own experience, I've noticed that even the people that are willing are going to do it, you won't know because the signs are not always obvious, and sometimes there aren't signs, and that could be difficult for a lot of people, a lot of family members, friends, whomever that think everything's okay, and then the next moment it's not. I've
Can I
dealt with
just
that personally.
let me let's go a little bit into that, Anthony. So, 98% of the people who complete suicide, no one knew they were suicidal, right? What does that say about us as a society? If that high rate of suicides, no one knew they were suicidal. And I think one of the things that really is is scary for me is I do a lot of postvention work after someone dies by suicide. And the family and the loved ones will say, you're someone who's lived with this, you've survived it, you talk about living with suicidality. What does that mean? Help me to understand, because I never got closure from my family member or loved one who killed himself, right? And so I don't even know what to feel or how to get closure. So I'm the one providing closure to a lot of people who have lost a loved one to suicide, because they're asking me, how, what do you think my loved one felt? How do you think they were feeling, or what is it that drove you to that point, or how did you so I'm actually playing a role in the lives of so many people who never had closure. They're still suffering and struggling with the pain of losing a loved one, and there aren't resources for them, right? There is a high rate and a high possibility that someone who loses a loved one to suicide can also lose themselves to suicide. So when you really think about the pain that is out here and how people are hurting, before the pandemic, there were, few things that people were hurting and struggling with. Now the pandemic has come, and it's like it's so many things in people's lives that are hurting them. You can't even pick one anymore. You have to pick 10 because all 10 of them are critical. Then trying to access the services and the resources to get help, it's even harder for you to get help from those resources. The requirements, the lack of, empathy when you go into these systems, the fact that they still don't understand that, people are really struggling. And so when they come through the door, they're already coming through in pain. The last thing they need is to be disrespected or dehumanized in these systems. So when we look at really where we are as a society, especially for us as men, there aren't resources that really helps us as men to be better in our roles that we play, or even in managing the challenges that we go through in life that can push us over the edge. And that right there, to me, is one of the scariest things that I deal with every day. The brokenness of us as men with no solutions. But we drink, we smoke, we have multiple sexual partners, we get involved in all kinds of different things, all simply because we're trying to deal with the pain that we're feeling.
Well, yeah, it's it's a lot. A lot of people cope in different ways,
Mhm.
especially when they're dealing with suicide on their mind daily. From family members and friends that I've had to actually come and tell me that they felt this way, that they didn't know how to share, and they thought for one moment that they weren't going to share, and they were just going to be gone. It's hard to listen to, but it also definitely affects you mentally and makes you think about that mentally as well. September 10th is World Suicide Prevention Day, and September is National Suicide Prevention Month. Why this focus? Why September? And especially September 10th, why that day?
Well, I mean, this comes from years of just this work being done, and seeing the significance during that time. World Suicide Prevention Day is actually celebrated across the world. Not celebrated, recognized. My apology with the choice of words. Recognized as around the world as World Suicide Prevention Day. And the world actually comes together on that day to recognize suicide as a real health crisis and addressing it. There are so many events that happens across the world. There's an international suicide prevention um, organization that really on that day does a lot too. Here in the United States, happily, the month of September designated as Suicide Prevention Month, where the country comes together, do different things around Suicide Prevention Month. But the truth is, there's still a lot not being done, Anthony. Like here in the state of New York, we have 62 counties, and of the 62 counties, there is still a lack of services or even the conversation around suicide. And so while this is September 10th, World Suicide Prevention Day, September being National Suicide Prevention Month in this country, we still are afraid of talking about suicide, addressing suicide, and making it a public health crisis that requires the time and attention that it needs. So this has been going on for a lot of years in terms of the recognition of this month and this day across the world, but it came out of just how many people are dying and how many people have died as a result of suicide. And as I said, it usually takes a celebrity who has died to bring awareness to suicide. And then for about 2 weeks, there's so much chatter about it. And then right after, we go right back to life being normal again.
Yeah, I agree. You can see it every time it happens to a celebrity. Everybody's talking about it. Everybody wants to know why or what happened. And it's purely because they're a celebrity,
Mm.
and a lot of them feel like connected to that person, even if they don't know them personally. But it is alarming to know that we don't have many services in the 62 counties in New York. It's alarming to hear that there aren't that many services in many other places too. And one thing I did want to touch upon, because you have the information from your own foundation and the Suicide Institute, um, is there a difference between gender and race uh, among suicide rates and men, women, black or Latino?
Yes, there is a big difference. So let's break that down for a minute. So men complete suicide at higher rates than females. The reason is because men choose lethal methods that are guaranteed to end life, right? They don't want to suffer. They don't want to feel pain. They just want it to be a very quick and over with process. So they choose more lethal methods to do that. So that's a gender on the gender side. Um, Females, they choose methods that sometimes, um, yeah, it's a lot of survival rates from that, but the lethal methods are not as used as much as is for the men. Talking about ethnicities, the Black and minority communities see a higher rate of suicide than other ethnicities because of the struggles that people of color are facing and how those struggles are manifesting itself into our daily lives. We see higher rates of suicides in our Black and minority communities. We see high rates of suicide in our Latino communities of the young females because again there is this whole thing about the physical appearance of Latino girls, right? And that physical appearance is something that literally drives them into the state of I have to look this way. Society sees us this way and be all that way. And it drives them into a high risk of depression that sometimes the self-worth, the self-hate, low self-esteem. And before you know it, they end up killing themselves, right? And you look again at a lot of the different ethnicities that are not addressing mental health or not recognizing mental health as a real thing. So you have a lot of Asian communities. You have a lot of Asian communities where they don't recognize mental health as a thing. Even another thing, there are some cultures in Asia that see suicide as honorable death, right? That to kill oneself is an honorable death, and how that is done, again, is something that is hard to fathom, but yes, it does happen. So gender, yes. Ethnicity, yes. But there's also the age piece, right? You see a lot of the youth at younger ages now being wrapped up in all this technology and social media and mobile devices, that their addiction to those devices, the addiction to technology, is driving high anxiety rates, high depression rates. They're not eating well, they're not sleeping well, they're not taking care of themselves well, because all they're fixated on are these devices and what the internet considers to be influential, right? So we're seeing recently, even up to yesterday, a lot of these influencers who are killing themselves because of just this whole world that they're living, the virtual world that they're living in, and the realities of how they portray themselves as one thing, but internally it's something else and what they're dealing with. Cultural, yes. Gender, yes. Sexuality, we're seeing a lot of things around sexuality driving a lot of these suicide rates, right? A lot of these young people are not sure what their sexuality is, what they want to be, and if they feel a little bit off, they feel like, they're that becomes a whole other conversation that is brewing up a lot. The other thing is on the cultural side, you have a lot of cultures who demonize mental health. They talk about it in such a negative and demonic way that even their family members, loved ones sitting right there beside them, hearing them talk about somebody else, can't even breathe. So imagine if I'm hearing you talk about somebody else who's going through this, and I'm sitting here in this house and I'm going through it. Am I going to tell you because of the way you're talking about other people? So there's that. The other part is religion, right? We've known for a very long time, religion has always been one of those things where does not engage in the conversation around suicide, because they say if you kill yourself, you go straight to hell. That was how religion really condemned suicide, in a way that people used to use religion as a way to coerce people into not wanting to think about suicide or killing themselves. You're going to go to hell. You kill yourself, you're going to hell. Your soul going straight to hell. So there's a religion side of it. There's the other side of it from the health side, right? Where our systems of health that are supposed to be taking care of us when we're not feeling well are so limited in the knowledge and understanding of suicidality that people are going into the health systems and coming out worse than they went in. There are people who have left clinics, left their therapist session, and walked right out and killed themselves. Right? So Anthony, there are so many things here around the topic of suicide and why we're afraid to have the conversation. But that fear should also be compelling us to really create more ways of addressing this, because it is now coming down to our younger children. Suicide is one of the least funded of all the health crises that we're dealing with. It is the least funded, it is the least talked about, and it's one of the least that's recognized until September, when it's Suicide Prevention Month. And people are killing themselves every day. Every day.
You have been listening to the Bronx Health Reach podcast, hosted by Anthony Davis. He will continue the conversation with Brett Scudder, Executive Director of Scudder Intervention Services Foundation, Incorporated, and the Suicide Institute, in the second part of our podcast. Thank you for listening.